morning, you're watching CBA News. I'm Mohammed, and these are the top stories today. Clinical lecturer at UCLan, Professor Samir Vora, has voiced his concern over the growing number of incompetent CPDs. We'll just have to leave that story for now. I'm just receiving some information, some breaking news, that the US President, General Eisenhower, has been diagnosed with Crohn's disease. The 34th President of the United States of America was found to have inflammation of the gut wall. This has led to his deteriorating health. Crohn's disease is known to flare up from time to time, with symptoms varying depending on the part of the gut affected. Other symptoms also include arthritis and skin rashes. Specialists at the Presidential Hospital have answered the call of duty and are treating his symptoms with medication. However, there is growing speculation amongst healthcare professionals that surgery may be the only option for the President if the flare-ups are very severe. Today I am joined in the studio by CBA health experts Professor Dumble and Professor Daw from the Royal Institute of Fecal Studies. Professor Dumble, how does Crohn's disease come about?
First of all, I just want to offer my deep condolences to Preston and also his family. It's a horrible condition to have, and he's a great man. The actual cause of Crohn's disease is unknown. However, many experts, myself included, do believe it's due to a combination of factors. Now, genetics plays a large part here. In fact, 1 in 7 patients will actually have an immediate family member who also has the condition. In fact, and if a patient has an identical twin, the chances of that twin then developing the condition is actually 70% and even higher. Now, Crohn's disease itself is thought to come about due to an abnormal immune response. The immune system starts releasing several non-specific inflammatory substances. Now, these substances are not able to differentiate between the good and the bad bacteria in the gut, and they then attack it, and that causes the inflammation which can then lead on to Crohn's disease. Now, the actual cause of this abnormal immune response is a matter of debate. Some experts do believe, but leading experts, myself again included, do believe it's due to previous, and Professor Daw, they do believe it's due to a previous infection, such as the MAP bacteria. It transfers from, for example, cows and goats through their milk, which hasn't actually properly been through the pasteurization process. It then goes on to, usually tends to be children. Now, this bacteria then causes the inflammation, which can then result in Crohn's disease. Now, another theory is how, in this day and age, a lot of people do tend to use a lot of detergents and disinfectants. Also, as soon as a child is ill, they use many antibacterials. So, a child doesn't really come face to face with many germs. Because of that, the immune system isn't able to actually grow itself, and therefore, this can then lead to an abnormal immune response in future. Now, smoking also has a big role in it. In fact, smokers are twice as likely to have Crohn's disease. Also, smokers are amongst those who have the most severe symptoms. So, if our president is a smoker, I seriously urge him to quit smoking.
Thank you. And Professor Daw, could you shed some light on how this condition is diagnosed?
Okay, so firstly, the physician will usually carry out an initial assessment just to ascertain the symptoms and any other contributing factors. They'll also ask the patient about recent travel, maybe, because sometimes things like traveller's diarrhea can present as Crohn's disease. After carrying out an initial assessment, then the blood and stool samples will be taken. Blood samples, we want to measure the levels of white blood cells just to see the level of inflammation within the gut, and also to see the hemoglobin levels, because some patients with Crohn's disease can have anemia. The mainstay of diagnostics is an endoscopy coupled with a biopsy, so it's just passing the camera through the backside and just seeing the anatomical structure and what's actually going on within the gut. So yeah, that's about it.
Thank you for joining us, Professors. CBA News has been given exclusive VIP access to the Presidential Hospital. We'll now go live to the scene where our health correspondent, Abdullah Biku, is at the bedside of the President. Abdullah, what's the situation like over there?
Thank you, Mohammed. I'm live at the scene where we have VIP access to the bedside of the President. It seems that the President is suffering from a chronic bout of Crohn's disease. So, Mr. President, could you just describe some of the symptoms so our viewers can understand what you're going through?
Symptoms of really bad diarrhea and pain right here.
Well, Mr. President, it seems you're complaining of common symptoms related to Crohn's disease. And furthermore, some people complain of wanting to go to the toilet, but when they get there, they can't pass anything. You don't have that, do you, Mr. President? That's good to hear. Other common symptoms also include fever and the general feeling of unwell, which you can tell the President has, as well as the presence in some patients, which I don't want to embarrass you too much about, are anal fissures. Swiftly moving on from there. Here with me today, I have two of the specialist consultants involved regarding the initial treatment of the patient, Dr. Salman Yusuf and Dr. Siddiq Modi. So Dr. Yusuf, could you shed some light for us regarding the initial treatment?
Well, as mentioned before, Crohn's disease is incurable, as patients are always at risk of relapse. However, we can induce remission, which is to temporarily end the signs and symptoms of the disease. To induce remission, we need to offer monotherapy with a conventional glucocorticosteroid, such as prednisolone or methylprednisolone. If these are not tolerated, then we can give them budesonide, which is less effective but has fewer side effects. If this is contraindicated also or cannot be tolerated, then we can use 5-aminosalicylates, which are further less effective. However, they have fewer side effects. We should not offer budesonide for severe presentations, and azathioprine, captopril, and methotrexate cannot be used for monotherapy. If patients don't respond, then we can add azathioprine or captopril to the treatment. However, with these we need to assess thiopurine methyltransferase activity. If this is deficient, then we can't add azathioprine or captopril. If this is below normal but not deficient, then we can add the purines at a lower dose. If the purines are not tolerated or contraindicated, then we can add methotrexate to the conventional therapy to induce remission.
Thank you for that, Dr. Yusuf. Dr. Omaji, is there anything you can add further?
Well, there's infliximab and adalimumab. These are the recommended treatment options for patients who have severe active Crohn's disease, and for patients who cannot tolerate the initial therapy that Dr. Salman here mentioned, such as corticosteroids and immunosuppressive agents. Infliximab and adalimumab should be given as a planned course of treatment for 12 months and until treatment failure, whichever comes first. And the patient should be reassessed every 12 months to ensure that the treatment options are clinically appropriate. Infliximab and adalimumab should only be continued if there is clear evidence of active ongoing disease. This can be determined by symptoms, certain biological markers, and further investigation. Specialists should discuss the risks and benefits of continuing treatment with the patients, and should consider a trial withdrawal from treatment of all the patients who are on stable clinical remission. And also for patients who do have relapse after treatment, they should have the option to initiate therapy again.
Thank you, doctors, once again for taking time out and joining us at SDL News. I would also like to focus upon further Doctors Talha Isa and Rebecca Ismail, who are specialist pharmacists.
Big on you. You're going to need some backup agents.
Don't worry about that.
Hands up now. You go.
Dr. Ismail, could you just run over the treatment what you have during this remission?
Yeah, thank you. To maintain remission, smoking cessation is probably the most important factor. So, Mr. President, your country needs you. I recommend that you stop smoking. Okay. You should stop smoking. As I recommend that you stop smoking to prevent that flare-up. With regards to pharmacological treatments, there's azathioprine and captopril that should be used as monotherapy, although captopril is unlicensed. Regardless of whether regardless of whether budesonide or glucocorticoids were used to induce remission, azathioprine and captopril can still be used. It's highly recommended, and it's important to remember that glucocorticoids and budesonide and sulfasalazine should not be used in the maintenance of remission, although they can be used to induce remission. Methotrexate is another unlicensed drug that should only be considered when, if it was used to induce remission, if azathioprine and captopril have already been used and they cannot be tolerated by the patient, or if azathioprine and captopril are contraindicated. Infliximab is another drug which is very effective, however, should only be reserved for those patients with severe active Crohn's disease, and should only be considered once every other option has been explored, including surgery.
Thank you, Dr. Ismail, for that knowledge. And Dr. Isa, is there anything that you can add further?
Yeah, we've also got to maintain remission after surgery, and this usually involves the use of 3 drugs, mercaptopurine, azathioprine. These are usually used when the patient has more than one infection or when there are complications involved, usually something like fistulae or adjacent structures or the presence of abscess. We can also use 5-amino salicylase. This is basically methylphenidine. It should be brand prescribed. This is because different brands do have different delivery characteristics, so it's not interchangeable. We also need to monitor the effects of the medication. Some of these medications can cause blood disorders, so we do need a full blood count. We usually measure white blood cells, neutrophils, because it can cause neutropenia, and also the mean cell volume. Other parameters that we may need to measure for the president is LFTs, U's and E's, hemoglobin, lymphocytes, and also TPMT, which is the enzyme responsible for the breakdown of azathioprine and mercaptopurine. We can also measure creatinine levels. Some of these drugs do have toxic side effects, so we need to look out for rashes, mouth ulcerations, bleeding and bruising. Methotrexate does have additional toxic effects such as nausea and vomiting, diarrhea, discoloration of the skin, itching. And also another thing we've also got to look out for is osteopenia and osteoporosis, which is a secondary cause of Crohn's disease. So we've got to measure bone mineral indexes. And also we've got to counsel the patient for methotrexate. He's got to carry his methotrexate booklet along with him. That will inform him when he's got to take his methotrexate, when he's got to take his folic acid. Try not to handle the tablet and carry his booklet whenever he has health-related appointments.
Mr. Preston. Thank you, doctors, for joining us once again and providing the insight into the President's treatment during his remission. Mr. President, back to yourself. Is there any other advice that the healthcare professional provided you with regarding your treatment?
Just one thing I asked them, I was quite concerned about how this will have an effect on my future, but then I know for the Vice President or the important presidential matters to keep the country running as well as I do. So he asked him what's the future looking like for me. It's variable, basically it varies on which form my career is affected and how severe are the flare-ups. Some people, they might go through their whole life and they might just have 1 or 2 flare-ups. Other people might have more frequent flare-ups or more severe flare-ups. And then he said, he goes that most people, within 10 years after diagnosis, they're still in work, like a citizen president, and they can live a near normal life. And but then one thing he said that severe flare-ups we were quite worried about, and still worried about it could be actually life-threatening. And also he said that about 80% of people, they require some kind of surgery to remove some strictures, and half the people require this surgery within the first 10 years after diagnosis.
Thank you, Mr. President, for that. Yeah, no problem. Back to you, Mr. President. Thank you once again for that VIP access into your health, and I'd like to thank the multidisciplinary team that is involved with the President's treatment. My name is Dr. Biku. Sorry, sorry, there seems to be a complication. The President's just taken a fall. Just bear with us 1 second.
Put him on the bed slowly.
Due to some unnecessary security issues, there are no medical personnel at hand. Therefore, we need the help of you highly trained pharmacy students to lead the treatment of the President. We need your help to save the President. The choices you make are crucial in saving his life. If you fail, you could be tried for treason. Which of the following symptoms is part of Crohn's disease flare-up?
Abdominal pain.
Abdominal pain. Do we have a general consensus on this answer?
Yeah.
Well done. You managed to identify the correct symptom of a flare-up. Now moving on to the treatment of an active flare-up. Which of the following treatments would we choose? Prednisolone. Let's have a look. Well done again. We managed to choose the correct medication to treat a flare-up for the President. And finally, which drug is recommended to maintain remission? Did I hear azathioprine? Should we go with azathioprine? Congratulations, we managed to save the President's life. The President was saved with your help. He returned to office and resumed all presidential duties. He continued to serve his country with heart and soul, but not his gut, as that was affected. Sadly, a few years later, despite your interventions, a severe flare-up of Crohn's disease, which led to a perforated gut, claimed the life of President Eisenhower.
All right!
So, just to recap, these are the main headlines today. President Eisenhower of the United States of America is dead. These are the unfortunate incidents that led to his death.
Crohn's disease is an inflammation of the gut, and the main cause is still unknown. Symptoms they include abdominal pain, diarrhea, and they mainly depend on the area of the gut affected. The flare-up treatment during flare-up aims to induce remission, and the treatment during remission aims to prevent flare-ups. So, thanks very much, and back to the studio.
Thank you, Abdullah. So, that's all from us on this story. Join us after the break for question time on Crohn's disease.